Greetings, my name is Brad. I've been a paramedic for 13 years, and I'm also a U.S. Army combat medic in the Alaska National Guard. Right now, we'll be going over trauma and medical training. This will more so be focused on trauma, and what we'll be doing is we'll be covering bleeding control, tourniquet use, and special considerations for patients. So let's get started.
How's it going, guys? So what I have here is kind of the first part of our lesson, sort of the main part, is a tourniquet. And tourniquet's been around since the times of the ancient Romans, probably about 600 BC. Technology has substantially improved since then with tourniquets and the use and application of them. So what we have is a cat brand tourniquet, probably one of the most popular brands. Has a couple parts to it. The part that twists is called the windlass. You got the entire strap right here, and then you have a windlass clip, which is this part that hooks the windlass into it. So what do we use them for? We use them to stop extremity bleeding. So your arteries go out to your arms and legs, and say something, like getting stabbed, getting a gunshot, an explosion from shrapnel, might cause one of those arteries to get disrupted and get cut. You can lose blood extremely fast in those circumstances. So that's when we had we'll be using tourniquets for that. So it's pretty basic to use tourniquets. We're going to go over a couple of different self-application methods and applying it to others. So it's possible to put a tourniquet on with one hand. And then we'll also go over some of the techniques to make it a little bit easier for yourself, and also easier for a care team, somebody else who's going to take the patient and go beyond your scope of care, and take them to the next level. So we'll also go over a couple of ways to secure your tourniquet, because just these by themselves are vulnerable. So vulnerable to getting removed, taken off pretty easily. So especially in the transport process. Other reasons why are patients are confused often when they've lost a lot of blood, and they might even try to self-remove the tourniquet. These tourniquets have made a huge difference in combat casualties, and especially since between the war in Iraq and Vietnam, that there's the use of tourniquets amongst other basic medical treatments have increased survival rates substantially. So one of the biggest causes of death on the battlefield is uncontrolled hemorrhage. Now, uncontrolled extremity hemorrhage, which is the only thing that these can do, account for about 13% of preventable combat deaths. But this is, almost a sure way to prevent that from happening. Given they don't have other injuries complicating the process even more, or potential comorbidities. But anyway, we'll get started, and I'll show you how to apply these tourniquets correctly. How's it going, guys? This is the self-application for the lower extremity for tourniquets. So let's get started. So I'm gonna lay down or sit down right here. Big important thing with tourniquets is you need to make sure that you put them high and tight, and also make sure that nothing's going to interfere with the circumferential wrapping. So remove anything from the pockets. So I'm going to do that. Things like my keys and wallet are in there. So here's what we do. We have the tourniquet. So you have that red end right there. Then you also have the end as well with the windlass. So you want to go ahead and feed the red end from the outside underneath this direction. And we're gonna go ahead
Make sure that you get it all lined up right. Get to this point, you get the Velcro to the outside, it's not twisted. And then feed that through that hook right there. I'm gonna show you a bit closer up. So that little part right through this hook. All right, this is how we're gonna be cinching it down. So there. So the reason we fed it that direction is that so we can pull it towards the middle of our body. And we do that because we get a lot more strength when we pull towards the middle of our body versus trying to push away. I wouldn't get much strength if I was trying to crank that down by going this way. So this is the next part that hurts. You're gonna go ahead and twist that windlass, and you're gonna twist it until that bleeding stops. Then you can also check for a pulse below the site. So, you know, if you don't have a distal pulse below the site and the bleeding has stopped, you can probably be pretty assured that you've done the job. So, get there, and then you're gonna hook it into that windlass clip. And then we have that little Velcro piece right here. Put it over that windlass clip to help secure it. So, now that you're there, make sure you check for bleeding. If you move, especially if you're moving another patient that has a tourniquet on, make sure you recheck that tourniquet when you, after you move the patient, because sometimes things get dislodged. So we will go over more techniques a little bit later about how to make sure that tourniquet is secure. Another question that pops up is, what if the bleeding is still continued? You could also use a second tourniquet, and sometimes that happens. So, and then you should always keep reassessing for bleeding too. Just because you stop the bleeding now doesn't necessarily mean you stopped it 5 minutes from now or half an hour from now. Sometimes it can get slightly shifted. Muscles can start to loosen up and relax, and then they're not contracting as much anymore. And so when that happens, it doesn't get as tight, and then that arterial bleeding can start happening again. So be mindful of those things. It's not something that you just put on and then you forget about it. So every single treatment, you keep monitoring your patients. So this is the first part of the March algorithm. So March, the algorithm spelled exactly the same as it, is written. So M stands for massive hemorrhage. So that means it's the first, massive hemorrhage is the first step that you do for taking care of somebody who's had a traumatic injury. That's what's going to kill them first. So if you don't stop the bleeding and they don't have any blood, then you've done no good for your patient. So you got to fix those problems first. But anyway, we'll get into the self-applications for the upper extremity. Thanks.
Welcome back, guys. This is the self-application for the upper extremity for tourniquets. So kind of the primary difference when you're applying it to yourself in the upper extremity is you're limited to only using one arm. I mean, quite likely you might have some injury that makes the arm that you're going to apply it to be unusable. So when you have your tourniquet, you'll have it prepackaged for deployment. So I always have this right here. It's generally folded like this. So when it's folded, then I'll go ahead and just pull it out, whip it out, and it can come undone. Now, you might even have to use your teeth if it really comes down to it, if you only really got one arm. So when you have it ready to go, you can go ahead and you can put it on that extremity, pull it up nice and high, and it can go over closed. Make sure, like, if you have tactical pockets, pull anything out of those pockets, otherwise it's not going to work. Pull that off, you cinch it down. See how I'm going towards the middle of my body again, just like how we did with the leg. It's the exact same concept. So This is that part where you're gonna wrap it around that as much as you can until don't run into the windlass, and that's where you tighten the windlass. So tighten that windlass. You're gonna tighten it until that bleeding stops. So you can check for a pulse down below, radial pulse, brachial pulse. So once that bleeding stopped and you got that windlass there, feed that excess through there. You're probably not going to have excess on somebody's leg unless they're really skinny, so that's why I mention it. And then that same Velcro strap will go right back over it. Sometimes you got to look and make sure that you don't have anything in the way of that Velcro. And then, boom, you're secured. So pretty similar concept to the leg. Really the only difference is you might have a lack of function in your arm, and you're going to have to resort to other techniques or figure it out along the way. So the best thing to do is to practice and figure out what works for you. I'm not going to say one technique works for everybody, but there are techniques that are commonly used across the board. So anyway, thanks for listening, and we will get into the application of tourniquets in general for patients, and also how to secure them.
So this is our individual first aid kit. As you see, it's not that big. It has quite a few supplies in it. We're not going to be using all of these in this training session, but we will go over a couple. So let's talk about some of the big important ones. So one of the most important ones is a pair of shears. And with these shears, you can obviously cut off excess clothing, things that are getting in the way, and expose your patient to see what's actually going on. Another big one, have a new tourniquet in there. Ideally, you should not reuse a tourniquet, even if you use it in a training situation. Use a new one. It's that's how they were designed and tested. Got a little bit of gauze. Now, this, it can be for minor wounds, packing wounds. There's a couple applications for this. So one of the bigger ones right here is our ACE wrap, and we use this to wrap wounds, specifically the junctional wounds. So junctional wounds being your inguinal, which is by your groin, your armpits, and your neck. So there's a specific way to wrap each one, and there are further trainings to learn how to do that. And an extremely helpful thing to have is duct tape. So we'll use duct tape to secure our tourniquets, and I will show you how that is done. Triangle bandage has multiple applications for it. Some of the more common ones are used for shoulder injuries, but you could also use them for wrapping your junctional wounds, and we won't be covering it in that course, but there are other trainings that we will cover it. And then we have a Sharpie. I just use it for marking times on tourniquets or taking notes if I have to do patient care. This right here is a chest seal, and I will graze over chest seals, if somebody has a gunshot wound to their chest cavity area and a sucking chest wound. This is what we're going to be putting over their wound. And then in here as well, have a pair of gloves. We have an emergency blanket. So the emergency blanket is for the last part of the March algorithm, which is H, so preventing hypothermia. And we got a few more things. So right here, this is an NPA. That's what it's called, nasal pharyngeal airway. It goes in the nose, helps prevent obstruction from somebody's a little bit, say they're a little bit, not necessarily comatose, but not quite with it. Sometimes
This will help them breathe a little bit better when they're in that diminished mental state. And then this right here is an emergency bandage. They were formerly called Israeli trauma bandages. I believe they were invented by an Israeli paramedic many, many years ago. Still very common, great applications to use it. And then this is another abdominal, sometimes abdominal pads, combine pads. This is just another thing to help with bleeding control. And then hemostatic gauze, this actually helps the blood clot. So there are a few different rules to it. The biggest one is make sure that when you're putting it in, you're actually putting it into the wound and actually holding it for 3 minutes. So kind of the last things in there, I have an extra chest seal in there. Then I have some alcohol pads and then antiseptic towelettes. So when you build a trauma kit, consider using all of these pieces of equipment. They can help for anything from minor issues to severe injuries. So anyway, appreciate you listening. Thanks. All right, this is the part of the presentation where I introduce my wife, Jessica.
Hi.
And so I'm gonna show how to put a tourniquet on somebody else's leg, an arm, and we'll go from there. So it's really the exact same concept with the leg, except it's on somebody else, so you don't have to feel the pain yourself. But anyway, I'll get over to her. Hold you your left leg. So I'll get your right leg out from under it. And I'm gonna feed it in. Same exact thing with that red piece going toward the center, Velcro toward the ground, okay? So get anything out of their pockets. So you have a little phone up there, get it up high, get that strap right through there, all right? And then this is where you do that cinching it down. Cinch it down all the way, go around so that way you don't have too little Velcro, all right? And then you're gonna crank that windlass until the bleeding stops. I'm gonna be nice to my wife and not completely cut off the circulation to her leg. So we'll just stop right about there, all right? And then we're gonna put that little piece of Velcro that I showed you on the windlass clip, we're gonna put it over that. All right, so a lot of patients, they'll tell you it's not comfortable to have a tourniquet on, is that right?
Yeah.
So, and a lot of patients that get tourniquets are very confused, and then they try to take them off. So this is why we have our medical kit, and then we also have duct tape, so it serves kind of the purpose of slowing down that process of it taking off, or your patient taking it off, or maybe just accidentally taking it off yourself. So this is basically what we do in the Army to make sure that that tourniquet stays on and there's not going to be as many issues down the line. So I'll go ahead and I will take that duct tape and we will wrap it around. You can also use just regular medical tape, generally wider stuff like the 2-inch would be good. But this right here, I believe is about 2 inches of duct tape. So we'll go around, make sure that it's good circumferentially. All right. And then you go ahead and you can take that Sharpie and then you can write the time on the tourniquet. So it's about 2 p.m. So we'll just write 1400 because military time is much more exact. But now that tourniquet, now that we have the duct tape on there, it's gonna stay in place. That's when we don't plan to move it. If we wanted to turn the tourniquet into an emergency bandage or just put a tourniquet lower down, then we're not gonna go with duct taping it. So anyway, appreciate you watching, and we're gonna move on to the tourniquet on the arm. Welcome back. We're here for the final part on the tourniquets. So it's also probably the easiest part of all the tourniquets. So I'm just going to show you how to put it on somebody else on their arm. So let's get started. So following the same rules, high and tight, going toward the middle. So setting up with going underneath with that red part. I went under her arm there. So we'll go here, through that little loop again. All right, and then crank that down pretty tight. All right, so I'm not gonna go all the way to the windlass yet, so because I have to crank that windlass. So I'll crank that windlass. I'm not gonna crank it very tight on her because I don't want to, do something that's unnecessary. So we're gonna simulate that I cranked it a lot more than I did. All right, and then we're gonna feed this through, and we're also gonna assess for bleeding. So you can check brachial, or if the arm is totally amputated, just look, see if you see any pulsatile bleeding coming out, or radial pulse. If you see the bleeding's been controlled, good. Secure that windlass up there with that, and then it's kind of up to you to decide. Do you want to keep that tourniquet on for a long time? Go ahead and put the duct tape around it so that your patient, won't take it off, and also it's going to be harder to come off if you were to make a mistake too. So I reiterate these points because this it might look like a basic skill, but it's one of the skills that gets messed up quite a bit. A lot of people, despite their medical experience, fail to put on tourniquets correctly. So it's a very perishable skill. You always have to keep practicing it. So just remember that if you have your own tourniquet, play around with it. You can buy them, or if you work in the medical field, you might be able to just come across one of them. So it's a very easy to use, life-saving tool. Anyway, thanks for watching. All right, guys, so this will be the final part of the M in the MARCH acronym, so treating massive hemorrhage. So we're gonna go ahead and start looking for the junctional areas, or the other areas that people can be bleeding, and just how to find them. So we use the acronym NAPOLA. So NAPOLA stands for neck, axillary, pelvis, inguinal, legs, and arms. So let's go ahead and go through it. So when you have your gloved hands, try not to wear a pair of black gloves. If it's all you got, it is what it is. And if you have a red lens, if you're working in a sort of tactical environment, it's going to be much harder to see blood. So you're going to have to find a way. So first we'll check the neck. We'll just go up behind the neck. So I'm going to go up behind your neck, check here, white. Do I have any blood? No. Okay, so then to the A. So axillary, that means your armpits basically. Check. Do you have any blood? All right, nope. So underneath the pelvis. Pelvis is always a big one. Pelvises bleed a lot, especially from gunshot wounds. So check there, we don't have anything. Alrighty? Inguinal, your femoral arteries, one of the easiest places to bleed out. Just use the back of your hand, up there, check. Got it. Move on. So if you do find something, fix it and then move on. So inguinal, then we got the legs. So then down each leg, just go like a little bit, little bit, little bit, little bit. All right, don't just do like one sweep and try to find it. So try to find it more accurately. Down each leg, there. Just keep looking at your hands. Okay, and then the last one is going to be the arms. So the arms, there, 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 and you don't necessarily have to do this in order. Just make sure you don't miss any parts. I just follow the acronym. But if you have another way that works for you, go ahead. When you find bleeding, you're going to go ahead and control it. So if it's on the arms or legs, obviously you're going to throw on a tourniquet to stop that. If it's in the junctional area, we're going to use wound packing material. So we will briefly explain how the wound packing material works. All right, so this is the final part of the presentation. So what we have here, this is a package of the hemostatic gauze, and as I mentioned earlier, we were going to go over how to do wound packing. So what I have here is I have a stake, and I have a simulated piece of hemostatic gauze. We keep it in a Z-fold pattern. That's how you're going to find it in a lot of packages. So I just pulled out regular gauze and turned it into that. So we do it to pack junctional wounds. Junctional wounds often are going to be, smaller, and they could be very large, though, and hard to stop. But let's simulate what a junctional wound would be like to pack and how to pack it. So I'll take this stake right here, and we're going to stab like a pretty good amount, just to simulate like a cavity that's in there. All right. So with that, go ahead and come in a little closer. We're going to take that Z-fold stuff, and you make a nice little wad out of it to start. All right, so with that wad, we shove it right into the cavity, okay? And we're going to shove it in there, and you're going to really put a lot of pressure up towards the heart. So we'll just say the heart goes this way. You're going to put a lot of pressure up towards it. And you're going to fill that cavity. So we always use the term peel, push, pile pressure. Peel, push, pile pressure. You're going to fill that wound until you cannot fill it anymore. And then after you've filled it up completely, you might have excess. You might probably go through a couple of these hemostatic gauzes. You'll take that gauze, put it on top, and you're going to hold it for 3 minutes. That 3 minutes is extremely important to help the clotting process with hemostatic gauze. That was actually this 3 minutes is something that a lot of people, even seasoned medics, still mess up. So if you can get it right and remember to do it, then you've already put yourself a step ahead. So big points there: push towards the heart, fill the cavity, and don't release until that 3 minutes is up. So anyway, appreciate you watching. That's the part of the presentation with wound packing. I'm going to go ahead and use this steak and just cook it. It's also why I didn't use the hemostatic gauze, because I don't want to eat that stuff. So thanks for watching, and we'll see you next time. Thanks for watching. I hope that you guys have learned something. This kind of reminds me of a quote, and this quote is popular amongst the Navy SEAL community. And the quote goes something like, "Under pressure, you don't rise to the occasion, you sink to your level of training." So I've heard varying statements of that quote across different communities, and I think it's true. So you're not going to be a superhero just because you have a tourniquet and you've trained a little bit with it. You're going to be a high performer if you actually train with your skills regularly. They're perishable, and you're not going to be an all-star if you're not practicing all the time. That's what the high performers do in all different walks of life, and whether or not it's professional sports, it's tactical medicine, it's just any career field really. So remember that. Another big thing: make sure your tourniquets are actually placed on correctly. So make sure you reassess your patient, and make sure you hold that pressure for 3 minutes when you have your wound packing material on there. So there are numerous training programs out there,
where I revert to the most was the Army Combat Medic course, and it's where I've learned most of my trauma medicine. So I will do my best, and even though I think I could still do better at refreshing my skills. So there's always something to learn. Find a way to stay interested. If you want to challenge yourself, you can test yourself out by doing tourniquets for time. An okay time would be about 1 minute. A pretty gold standard time would be about 30 seconds. And if you can do it in 15 to 20 seconds, then you're doing pretty elite. So, but are you going to do 15 to 20 seconds if you take 6 months off and don't pull out a tourniquet and make sure you're good at it? You're probably not going to rise to that occasion. So, but that 15 or 20 seconds might save that injured casualty a lot of potential lost blood, especially if you're out in a remote environment where getting blood products is going to take a couple of hours. So, anyway, thank you for watching, and we'll see you next time.